The member for Scarborough-Guildwood.
Thank you, Speaker. My question is to the Minister of Health. Ontario is seeing a troubling rise in patients' hospitalization due to COVID-19. As we are in the throes of the second wave, Scarborough General is at 90% capacity, and the COVID patients make up 75% of the ICU patients. Scarborough is consistently seeing positivity rates in their assessment centres at 17% and in the high teens. I want to thank the hardworking Scarborough Health Network and Scarborough Centre for Healthy Communities frontline healthcare workers for the assessment that they're doing. Minister, Scarborough's existing health system cannot handle this level of community spread. Scarborough needs its facilities to be in good repair and a new hospital so that it can continue to provide excellent care at this critical moment and in the future. Speaker, through you to the Minister, will you commit to expediting the master plan for a new Scarborough hospital today?
Very much, Speaker. Well, certainly we are aware of the concerns and issues that Scarborough General is having. They are in the middle of one of the hot spots, and that's one of the reasons why Toronto was put in lockdown, to stop this community spread and to make sure that we can bend this curve and get the numbers more under control. That being said, we are working very hard with the great people at Scarborough General to do the work that they need to do. And as the member will know, there is a process for hospitals to be rebuilt, and that we have been working very hard to move this forward as quickly as possible. This is an issue to many members of this legislature, but the process moves forward as it does. We're trying to expedite it as quickly as possible.
Supplementary question.
Thank you, Speaker, and I thank the Minister for her response. And of course, as you know, Scarborough Health Network is in that process. And what I'm asking of you today is to perhaps look in on that and move that process forward. They have submitted their master plan and are really just waiting on the ministry for that. As you know, public health experts have sounded the alarm that Scarborough is amongst many reasons seeing a higher rate of hospitalization in ICU patients with COVID-19 because of the vulnerabilities in the population. And as you've said, that you acknowledge that we need to protect our most vulnerable populations, those with pre-existing conditions and seniors. There are many situations in our Scarborough community that make it more vulnerable. So will you work with the public health units on their outreach plan and plan to isolate families who test positive and giving them that option?
Thank you. And the response.
I can certainly advise the member that I can make inquiries as to the status of the application for the Scarborough Hospital, but as you will also know that I'm not able to interfere in it. There is a process that has to be followed to make sure it's fair and equitable for all parts of the province. That's the way it should be, and I don't think anyone would have any disagreement about that. But we also want to make sure that we can help within the community, to help the public health unit, to make sure that they can do the testing, tracing, isolating. If they need more contact managers to help there, we've already provided several hundred additional contact managers to Toronto Public Health. I know that there are some situations where quarantine management has been asked for, which is provided by the federal government. I have had several conversations with Minister Hajdu about that. I know that some have been opened in the western part of the city, but if they're required in Scarborough, I would be more than happy to speak with Minister Hajdu about that as well.